Brand new numbers on how many people in our country are dying from cancer. The American Cancer Society releasing a large study showing a major drop of 20%. That's significant. Dr. David Samadi, a member of the Fox News Medical Aid Team, chief of the Division of Robotics at Mount Sinai Hospital. Dr. Samadi, why is this happening?
This is a fantastic news for all the cancer patients out there. Jamie, the peak of cancer death was highest in 1991, about 20 years ago. And so we've seen a major decline, and 20%, as you mentioned, is a huge number in this. We're basically saving over 1 million people over the last decade or so. So the reason why this is happening, and mostly has to do with lung cancer, we see that the death rate has gone down. Look at this, 215 over 100,000 in 1991. Now it's gone to about 173 per 100,000. Part of this is because of screening. And there has been a lot of debate over the last few years whether screening for breast cancer, for prostate cancer, for colon cancer, does it really work or not? And this is the answer today. And you can see that you have to get screened. That information is very powerful. And knowing it early on, you can obviously do something about it. Lung cancer, prostate cancer, breast cancer and has been a major part of this, and that's a major improvement in life quality.
It's wonderful news. Let me ask you about, in particular, cancers. Are less people smoking, and that's why lung cancer deaths have gone down, and are more people drinking, that's why liver cancers have gone up?
Great answer. You look at the lung cancer, we can see it's reduced by 30%. Breast cancer has gone down as a result of mammogram by 30%. Great news. Colon cancer by 30%. And you're ready for this? My own field of prostate cancer, we've done a reasonable job, decreased by 40%. That's huge. And we think that, smoking awareness and all the things that we've spoken about in this program and other places has helped tremendously. No one knows exactly why liver and pancreas is on the rise. Obviously, one of the major risks are alcohol and hepatitis and other things, but certainly we still have a long way to go. In 2013, you're going to see 1.6 million new cases of cancer, and unfortunately still about 580,000 people will die from cancer. We've come a long way, and certainly all of these educational programs have helped tremendously. We still have a long way to go.
You're always proposing that people get screened for everything and that they start early. On the other side of it, with treatments available, will we see a cure to cancer in our lifetime? And what cancer is the most likely? Because I know the one that remains very deadly in the list in this study is melanoma. Is it as easy as using sunscreen?
Well, I think that we are going to see a major improvement, and this is probably one of the best questions that's come up. Are we going to see this in our lifetime? And I'm very, very hopeful. I think we're going to first see in the next few years which cancer is really deadly and which one is really not going to kill us, and really give this individualized care to our patients. And the decade after, hopefully, we will be able to defeat this disease. So yes, we've come a long way, but we're getting there.
If I may, the silver lining that I hear in all of this is research on top of research, and you become more aware of what type of cancers you can combat and perhaps change behavior. That's remarkable to see what you've been able to accomplish since 1991, which means the research is working, right?
The research is working. We're getting into the genetic codes. We're trying to find out why someone dies from prostate cancer and somebody else can live for a long time. Exactly the chemistry of these cancers are extremely vital for us to understand. And we're basically taking like one step at a time against this cancer. So this is a great news, and more to come in the future.
More and more targeted therapies. Dr. Samadi, I want to let all our viewers know that are big fans of yours and Dr. Siegel's that tomorrow we'll have inauguration coverage on the Fox News channel, but next Sunday the doctors will be back.
Look forward to it.
Great to have you here.